Birds have always been an interest of Heather Hagopian's.
Feeding birds and watching birds has been a hobby of mine for many years. I just get joy out of watching them and studying them.
An interest that keeps her grounded during an unexpected journey.
So I had my annual mammogram early March, and I went into it thinking they might find something because I had that mass that I felt earlier in December.
So when the mammogram was done, we could see a pretty worrisome appearing shadowing architectural distortion in her breast. We could see some microcalcifications that were worrisome that hadn't been there before. And on ultrasound, we could see a mass.
They said, we'd like to do a biopsy, and I have had one before, so I knew what to expect with that. And I said, can we just do it now?
The biopsy showed that she had a very poorly differentiated, high-grade infiltrating ductal cancer of the breast that was hormone receptor negative and HER2 positive.
The news turned her world upside down, but Karen Roberts, who has known Heather for decades, was willing to help.
I took it on myself that my role was just do everything I can so that she doesn't have to worry about taking any care of anything but herself.
Karen was there with me taking notes frantically, and a lot of the things that were even discussed, I didn't even hear. So it's very important when you go through something like this to have someone with you.
Whenever she would meet with the doctors, if she was allowed to have someone come in with her, that's where I saw a little bit bigger role for me.
The doctors recommended chemo, and I questioned that at first because I thought, well, if it's a lump, if we can feel it, why don't we just have it operated on, right away, get it taken out and be done with this.
If we give the chemotherapy first, we learn a great deal about that particular tumor and how sensitive it is, and then we can gauge the therapy appropriately and give extra drugs if they fail to get a complete response. Those extra drugs can be life-saving, so we like to do it first.
As Heather started chemotherapy, the COVID-19 pandemic changed everything.
The first time I went, the nurses were great. Everybody talked me through everything, very supportive. And mind you, I had to do this alone again because of COVID, so that was scary.
In her case, the benefits of being treated immediately far, far outweigh the risks even of the COVID pandemic. So that tells you that if you have a lump, you don't know what kind of cancer it is until you've had a biopsy. So people don't want to delay having any symptom evaluated.
As the treatments went on, it got a little worse, a little more intense. I started to lose my hair, and that was a big thing for me. I rock the bald look is what I told, so I don't mind it so much. And actually I walk around with my head like this, just to kind of show other people too, hey, it's okay.
Cards, gifts, and words of encouragement from family and friends flooded Heather's mailbox.
Honestly, I think I received a card every day for the first couple months or so, and they're still coming in, which is amazing.
The next step in Heather's journey is surgery.
So I decided to go with the bilateral mastectomy. Everyone supported me on that decision because, again, it's my decision and everyone's different.
She's just a very upbeat person, and she's weathered this unbelievably well. And I think she's excited to be at this juncture and to be finally getting this tumor taken care of and out, though surgery is not something that anybody is truly excited to have to go through.
I have such faith in my doctors. They've gotten me this far, and it's kind of given me a new lease on life, just to appreciate every day, appreciate people around you, appreciate the simple things in life.